Right. Again, welcome. My name is Nicole Christensen, and you are at the Dementia webinar, Tips to Communicate, Connect, and Engage. I am the president of Care Answered. I'm also a board certified patient advocate and author of the book From Crisis to Calm, a patient advocate's take on healthcare coordination for you, the common caregiver. And I am so excited to be able to have this webinar presented to you by Melissa Gallagher-Cashman. It's going to go over all of the things that we had just talked about as far as those tips to communicate, connect, and engage. And so many of us know people or are ourselves struggling with diagnosis of dementia. We're all pretty aware of it. And I just want to share a little story about my personal experience. I have lots of professional experience, but this topic really speaks to me. So those who don't know me, you may not be aware that my father was diagnosed with dementia over 20 years ago. He has since passed in 2016. And I'm the youngest of 6 children. And we're all fortunate enough to live in New York at the time. So we were all hands on deck. But as we know, dementia diagnosis and the progression of the disease can change people and how we interact and connect with them. And so in my experience, my dad was a retired bus driver. So he was a driver at heart. And that means that that's who he was. He drove us everywhere, professionally and personally. He was a driver. And then came the time when we had to have the discussion about not driving. And that was really hard. The other fact about my dad is that he hated feet, like just thought they were gross. Most people's feet were ugly. And he certainly wouldn't think about touching somebody else's feet or having his feet being touched. But again, as the disease progressed, he couldn't cut his toenails. And so one of the things that we did, I asked him if I could give him a pedicure. And that's what we would do. And we would engage and connect and have conversations while I was doing that, which is very different from what he would have done before, but it was a new way to share and connect. So we all know that it can change one or how we react or how we communicate with them, but they're still the person we love or the person we're caring for. So again, I'm really excited for Melissa to be here and share some tips. So I consider Melissa part of the Care Answered family. We have worked together with clients and all of them rave about her work. And I'm really happy to be able to have her here today. So let me introduce her. She's got so many letters after her name, but I'll go through a few. So Melissa Gallagher-Cashman is a board certified therapeutic recreation specialist, a certified Montessori dementia care practitioner, a certified dementia practitioner, and certified Alzheimer's disease and dementia care trainer. She has 20 plus years working with CTRS, the Certified Therapeutic Recreation Specialist, in various settings, including mental health, brain injury, physical medicine and rehab, and long-term care in clinical, residential, and community settings. She is the owner of Creative Caregiving Solutions, Inc., where she mostly works with individuals who have Alzheimer's diseases and other related dementias. She enjoys combining her skills and experience to bring her clients person-centered, evidence-based, in-home, and virtual recreation therapy services, caregiver training, consulting, and in-service for organizations. So without further ado, I am going to introduce Melissa.
Save that number. The dementia class.
Okay, so I'm going to share my screen now, right?
Yes.
So I can put the presentation up. Everyone should be able to see. Okay, so thank you, Nicole. That was such a nice introduction. Welcome, everyone, and thank you, Nicole, for having me. I really appreciate that. I hope that in this hour that we spend together, you know, even if you are somebody that works with individuals who have dementia, or you have someone in your family, or you're just coming to learn some more, I feel like you will at least walk away with one new thing. I'm pretty confident of that. So again, didn't really know who my audience would exactly be. So I tried to arrange this in a way that it would kind of reach everyone, because no matter what it is that we're doing, we always need to have good communication before we do anything. So I created Communicate, Connect, and Engage. And this is what I came up with. So this is the outline. We will pretty much be sticking to this. It kind of morphed into a different direction, but in the end, you'll understand that. So anytime I do anything like this, I always like to start with just a little brief review of dementia. What exactly is dementia? So it's defined as a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. So that's the key thing there. You may have heard of mild cognitive impairment. Dementia differs from that because mild cognitive impairment, although it shows up on testing, it does not interfere with the person's daily life, right? So that's kind of a difference. Alzheimer's disease is the most common cause of dementia. So Alzheimer's disease causes a person to have dementia symptoms. So it's not a single disease, it's an overall term, like heart disease. So some of the diseases causing dementia, Alzheimer's disease accounts for 60 to 80% of the cases. So that's why we hear of that the most. There's also vascular dementia. There is something called mixed dementia, which is actually mixed dementia, two different types of dementia. And then the last, Lewy body, frontotemporal dementia, Parkinson's, and Huntington's. So you've probably heard of those. The second one, frontotemporal dementia, is actually, my father lived with that for 7 years, and he has passed. So a lot of my experience was kind of hands-on with him, along with a lot of the work that I do or did working in long-term care. So cognitive functions, we hear that a lot. And the reason I wanted to put this on here, we're not going through all of them for time's sake, but what I did was I did put them down, and I actually put the areas of the brain where these actual functions happen, like which parts of the brain are responsible. Because I know for me, when I understand the brain, you can understand dementia better. And when you can understand that, you can understand the person better. So the first three, perception, attention, and memory, those are all really important factors of communication. So I thought it was very important to put those on there, because a lot of times we think right away memory. Memory is a big part, especially with Alzheimer's disease, but there are other things going on. And perception is something that we really need to take a step back and think, how is a person perceiving? We may know what we want to say. We may know what it is that we want them to understand or to do, but sometimes the person is not perceiving it that way. So all of the things that we'll go through, you'll find a way where you can pull and get to know the person that you are trying to communicate with and use some of these tips. Again, more cognitive functioning, executive functions. So that's in the frontal lobe. So obviously for myself as a therapist, when I'm programming for people, I program a lot different for somebody that has Alzheimer's disease or somebody who has frontal temporal dementia, because you get to kind of see some similarities. although everybody is individual. And the last two are a little more complex, so we will talk about those in a couple of minutes. I just wanted to put up the brain there so you can see this kind of a side view like that. I've learned a lot about the brain doing this work, because when there's an answer that I don't really know, I can't really explain something, I want to know why. I want to understand exactly where these things are happening. Okay, and I showed you this because the hippocampus, as we know, which is very important in our memories, the storing of our memories, it's kind of in between the basal ganglia and the cerebellum, just so you know where it is. And again, talking about the hippocampus, you know, when people have damage to that area of the brain, say if somebody has a head injury, okay, because you hear about this, and people will get amnesia. So they have a loss of their declarative memories, amnesia. Sometimes, hopefully that comes back. Usually it does. Sometimes it doesn't. So I wanted to talk about this because the difference between somebody having dementia from a brain injury, that's kind of static. So it's staying the same. The dementias that I mentioned earlier, they are irreversible. So they are progressing. And that's what the difference is. The brain is amazing. It has ways of kind of finding new pathways. So that's how you'll hear about people maybe who have had a brain injury, they learn how to walk again, or they need to learn how to speak again, things like that. So, so that's why I wanted to show you that. So there are actually different types of memory. And this is important in communication, because when we know the difference, we can understand better where people with dementia are having some issues and how we can help better communicate. So a procedural memory, that refers to our knowledge of things, how to perform tasks, things that we remember automatically. We get in our car and we drive. You know, you pick up a ball and you throw it. You don't have to think about it. Okay, and as you can see in the earlier diagram, there are different parts of our brain that are responsible for procedural memories. Declarative memories, okay, those are facts or memories of past events, okay? I won't go through all of them, but what I thought was important to show was that on the left side of my screen under declarative memory, those are the things that people with dementia, when they're starting to lose memories, these are the types of things that they are often losing first. They have procedural memory that we can find ways to communicate. So skills and location learning. People can learn a new way to get somewhere, and we'll talk about some of those cues. Categorizing, being able, priming. So perhaps someone is having difficulty remembering someone's name, someone new in their life, but they can remember, oh, you know, that's a very nice person. They have glasses. They can relate the glasses to that nice person. That's kind of priming. Visual spatial ability. It refers to a person's capacity to identify visual and spatial relationships among objects. This is important because visual spatial cognition, the one on the bottom, it includes skills such as searching for and locating objects. This is important for many of the tasks that we do in our everyday life. Things like drawing a picture, making the bed. Individuals may be quite capable of making the bed, but perhaps their visual spatial skills they're being affected. So they know the steps, or even perhaps maybe there's some motor skills. They're not able to bend. They still know how to make the bed, so they can possibly assist in that. They can even do parts of that task, okay? They still know how to make the bed. So I thought it was important to mention that because, again, and I'm guilty of this too, before I learned more, it's not just, oh, well, the person forgot how to make the bed. There's a lot of things that go into making a bed, okay? Again, putting items away too. Locating a room. These are all parts of communication. Putting a puzzle together. So some common causes and barriers to communicating with dementia patients. So some of those changes we call violation of conversational rule. So individuals are starting to realize perhaps that they can't put their thoughts together. What we call conversational rule. You know, somebody says something, they say a sentence, and then the other person answers back. So they're starting to feel that they perhaps cannot contribute. And then what you start to see is people will often withdraw. So even if it's something as simple as, you know, being part of a neighborhood card game, the person may still be able to play cards and remember the rules, but, you know, conversation, it's a very social activity, playing cards. And some of the other things, you know, making unrelated statements. These are some of the changes. Some other barriers, empty speech, you know, where individuals, they will be speaking, but it's not making any sense to the person that they're talking to. People will often find ways to kind of compensate for this. And if you really listen closely and you know the person, you get to know those, you know, when they're not really following the conversation, you know, who knows, it's a way to kind of end it. And then of course, aphasia, which is something that we hear a lot about. So receptive aphasia is actually in the area of the brain called Wernicke's. It's called Wernicke's aphasia. And then we have expressive aphasia. So the reason I thought it would be important to show you this, as you can see, they're two different areas. So it is very common for an individual to perhaps be experiencing expressive aphasia, but yet they can understand. They understand what is being said to them. So that's why, because it's two different areas of the brain. And sometimes some people will have both, and one degree is worse than the other. So we find a way to work around that. I'm not going to cover all of this. As we all know, the English language is very complex. And if you've ever tried to learn another language, that is equally challenging. There are lots of things that go into language, you know, phonology, semantics, syntax, pragmatics. So people with Alzheimer's disease, they often have difficulty with language expression, word fluency, and naming objects. And in later stages, speech may be lessened due to word finding difficulties. So some medical barriers, you know, just medication can sometimes be a barrier to communication. Vision disorders. So, you know, if somebody is visually impaired, they have already learned different ways to use their other senses. So that's very important too when working with individuals who have dementia or communicating with them, because you need to kind of make it multisensory. That's what I tell people all the time. You need to think about visual. I know that's not a good example. I was talking about vision disorders, but you know, if people are not understanding spoken word, we use pictures, you know, different signs, tactile, you know, smells. All of those things can awaken memories and help to communicate better. And the other thing I want to mention, which is pretty important to talk about, is depression. You know, when I teach my 8-hour class, we talk a lot about this because individuals with dementia, they can experience depression too. You know, depression is a real illness. You know, we know there's something going on. There's an imbalance in the brain. So people can experience depression and dementia, and some of the symptoms sometimes overlap. So it is very important to be aware of that so that we can help people. We can get them the help they need, and perhaps medication, because 40% of individuals with Alzheimer's experience depression, and it is very diagnosable and it is very treatable. So when people are experiencing depression and they have a decline in function because of that, that often will lead to caregiver burnout, and then that often leads to premature placement. So some mistakes that we often make. I have learned to really slow it down a lot. I'm one of those people that I like to do things quickly. I go here, I go there. You know, we all are guilty of that. The one thing that I think this year we all kind of had to slow it down a little bit, take a step back. That really never works. Speaking too quickly. We want to speak slowly and clearly, and loud enough, but we don't want to raise our voice. A lot of us make the mistake of asking memory questions. You know, sometimes I catch myself, you know, it just really sets a person up for failure if they can't remember it. So, you know, we'll talk about looking at photos and things like that a little later. But, you know, if we can all just kind of train ourselves to just, you know, kind of ask people to talk about their day, or, oh, you look so happy today. You know, it's a beautiful day outside. You must have had a pleasant morning. And then that opens the door for them to tell you what they want to tell you. Okay, giving lengthy explanations. I think that we want to try to explain things to people. There are individuals with dementia who are often confused, and perhaps they are believing something that is to us not true, but arguing does not get you anywhere. We want to kind of meet people where they're at. That's really true in every aspect of life. But, you know, when trying to explain things to individuals who have dementia and are not understanding, we want to give an explanation that is truthful, if you know, but not too involved, because you want to just satisfy the answer. And again, using words that are not familiar to the person. You know, somebody could be used to the word couch and I'm saying sofa. You know, those are things that are good to know. Like I've always called it a bedroom dresser. There are some relatives of mine who are older, they call it a bureau. If you said that to me, I would not know what you were talking about. Benefits of good communication. So, you know, we all want to feel validated. We all want to feel heard. Good communication, it reduces isolation and depression. It increases self-esteem, prevents catastrophic responses. And if you don't know what a catastrophic response, it goes something like this. So you could be maybe painting or doing some kind of activity with your loved one, and you know, you want to clear the table off because it's dinner time, and you say, okay, it's dinner time now, and you start clearing off their, you know, the things from the painting and everything, and all of a sudden, don't touch my stuff. Okay, so that's a catastrophic response because it's kind of a little over the top, but given the situation, we need to take a step back. Again, is that person really understanding what we are doing? How are they perceiving that? Did you really communicate exactly what's happening? And that's where you need to go back and explain so that those things don't happen. So where do I start? Where do we start? Well, I like to look at it as creating moments. Life is about moments, you know, they're happening all around us. And sometimes we miss some of them. We're not present, we're not paying attention. So I like to create moments with people, moments of joy, you know, where I'm connected with that person and we are communicating. That's really the goal. So it starts with making the conversation about them and not you, and being flexible and including people. You know, if you've ever been in a conversation where you were not included, I'm sure you didn't feel very good about that. And, you know, we need to be aware of that. And we need to find ways to help people be included, help people enjoy wherever that conversation is, whatever is happening, even if it's at a family event, and, you know, trying to be aware of that, and recognize when people are tuning out. So I can't really see everybody, so hopefully people are not sleeping by now. But, you know, how are we keeping people engaged? You know, I'm a therapist. I've worked in many places, and you know, I've walked through places where, you know, I'll see like the first 3 people and they're a part of the activity, and then everybody else is, okay, so that's obviously not the right activity. But even in just, you know, everyday life, and when you are trying to communicate, you can tell when people are tuning out. And the last one I thought I would mention, sometimes people will refer to themselves in the 3rd person. So if those things are happening, you understand that that's how that person is communicating. And you just kind of, you know, you understand that and you go with it. I have a client who, she'll show her artwork that she did, and she says to me, she did this and she used, you know, this color. And, you know, I just say, oh, it's beautiful. You know, the use of color, it's so beautiful. I don't say, oh, that you mean you're talking about you. I don't say that because I know that, paying attention. Connecting with emotion. There are times where you may not, a person may not be able to completely express exactly what it is they're trying to say, but you can pretty much tell a person's emotion. And if we can connect with emotion, we can communicate better. We can at least validate their emotion, and sometimes perhaps, you know, move on to something more pleasant. Using brief phrases, single step directions, you know, less is more. 1 step. We don't want to overwhelm people. Okay. So I'm just going to take a drink of water, excuse me. So I have been told by my mother that when I'm angry, my looks could kill. And I think she's probably right. I've also been told by many people, hey, you know, you're so much prettier when you smile. I think I have a resting angry face. Okay. So I try to be aware of that. I have to say, honestly, when I am working and I'm doing my thing, I'm usually smiling a lot because we have a good time. But it's something that we all kind of need to just remember, because a lot of times people are going by that nonverbal communication. They're looking at you and they may not be understanding some of the things that are coming out of your mouth. I actually have a colleague who he owns a companion agency, and he calls himself the happy teddy bear because he's very tall and he's a very big presence. So when he goes into people's homes and is, you know, doing an assessment, he's very aware of that, because he can look very scary to people that don't really know why he's there. So I think, you know, that's a good example of that. And again, just some other things, which probably, you know, some of you have heard of. It's kind of some common sense stuff. You know, modeling is a good thing, you know, showing somebody what it is you want them to do. Oh, come sit down. Or even, you know, actually sitting, showing that you want them to sit in that chair. And then I talked about this earlier, using pictures or typed signs, or a combination of both. We as a nation, we all need to be looking at dementia. It is a disability, but like any other disability, people just want to live their life, and they want to be able to live it and go into the community and enjoy things just like we all want to do as human beings. So the Equality Act of 2010, it actually states a physical or mental impairment that has a substantial and long-term negative effect on a person's ability to do normal daily activities. So this concept of cognitive ramps is something that you probably have already seen. We hear about ramps for people who have physical disabilities so that they can, you know, navigate and get to places in their wheelchair. These are called cognitive ramps. Okay, and I'll show you some examples. So it could be something, this, you know, why does she have bras and underwear? So it could be something as simple as putting a picture of items on somebody's dresser drawers, you know, where items go. It can help the individual be able to put their clothes, you know, in the drawers. They can still do the task. Nicole actually mentioned earlier that the Montessori training that I took. So I utilize a lot of those practices in my own practice. And one of the things you may, if you've been in assisted livings or any skilled facilities, people that use this approach, you'll see things, you'll see like activities set up, and you'll see signs where individuals can, read the sign and then just independently do the task. These are just kind of cues for people to help them out. They can still do the task, to find things, labeling things, okay? So redirect, you hear that a lot, versus change the subject. So there's a big difference. Nobody likes to be dismissed. If you're expressing your concerns, we've all been there. Nobody likes that. We want to be heard. We want to be understood. Even if the person can't really completely help us, at least we know that they've listened to us. So, in a situation like this, I've been, in situations where I've been with an individual and, they are missing the person. They're missing their loved one. And, I miss my wife. Something like that. And I could say, oh, well, you know what, why don't we just draw a picture over here? And, that's not really redirecting. It's really kind of changing the subject. I may kind of want to take their attention away from that, but, validating the person's feelings and saying, I'm so sorry. I know that you miss them. And why wouldn't you? Because they're great. And I know how much you love them. Hey, you know what? How about we make a card to show them how much we love them? Something like that is more of a redirecting, because you're still validating what they're feeling. So we connect with someone when we start to build trust. So Nicole told you a story, so I will tell you a little story now. I'll tell you a story about Nicole. So Nicole and we know each other for a few years, and I remember when I first met her. And if some of you are working in the field, you probably, you network with people, you meet all different types of people. And there are some that you just really connect with. And there's reasons why, because you probably have something in common, or maybe you have the same values. So Nicole, well, first of all, I knew her through a mutual friend. So he spoke very highly of her. And we both are women, and we both own businesses. So I thought that was cool. She is very kind, and if you know her, you know that is true. And we both are very passionate about what we do, and we both have had, episodes in our life regarding loved ones that kind of really got us into what we do. And that's a common thing that we shared. And as I got to know her, and as she got to know me, we have collaborated, and she has referred people to me, and she recently helped my family with a very close friend. So that's how we learn to trust, when we connect with people. So how do we do that? How do we connect with people? So I call it the hook. It's finding things that connect us. So professional and paid caregivers, they know the person for who they are now. That's pretty much a given. The advantage is that it's kind of a clean slate. So you're seeing the person for who they are now. The disadvantage, it's a clean slate. You really don't know much about the person. Family members and friends, they know the person when. So the advantage, they have a history with the person. They are emotionally connected. The disadvantage, they have a history with the person and they are emotionally connected. It is very difficult. Okay, it is very difficult to watch those changes. I know, I've been there. So we have to collaborate. This is a very important piece in the work that I do every day. We all need to collaborate. What a family knows can help me to find that way of connecting. And when I find it and I help the family to understand why this works, we all work together, and then we're communicating. And then the person is happier because we're connecting. So we have to be detectives. We have to look for these things. For me, I have to do my own thing to get that information. Some of you may just have the information. You just have to kind of think a little bit. You have to be a little creative about what it is that you know about that person that will find that hook for you. What makes them unique? You know, what gives them purpose? And what are their dreams? And what brings them joy? These are things, you know, that we all want. We all want to feel like we have a purpose. We want to feel successful. You know, what gets you out of bed in the morning? What brings you joy? So for me, I focus on music. I use music a lot. That's something that reaches everyone. It's like the common language. I do a lot of, I call it movement because I try to disguise it because people don't like the word exercise. I do a lot of creative expression. I think people need to express themselves, whether it's art or cooking, cognitive skills, and self-care. I think it's really important for all of us to take care of ourselves so that we can take care of others. But I think we all have that. We like to help people. You know, everyone has the ability to help somebody, whether it's sharing a story or sharing knowledge and, you know, nurturing. That's when we feel good about ourselves, when we feel successful, right? I mean, I always try to help people, you know, when I'm out in the store, and it makes you feel good when you can do that. Again, so type of music. It could be type of music that somebody likes. It could be their pet dog or cat. That's worked for me really well. Pictures of a person's pet, or sometimes even a stuffed animal, you know, objects, giving somebody something to hold, like a comfort item to feel safe. Sports team. I had a client who loved the Yankees. So what do you think I wore on my head when I went to do that assessment? I wore my Yankee hat. It was instant connection. So connecting, you know, just a couple of examples. I already talked about the Yankees. I had a client who was very minimal verbalization. She really wasn't really talking much, really was having a hard time trying to make that connection. And I knew that there were lots of things that we could do. She loved to cook. She loved to bake. And so, you know, going back to when I used to work in long-term care, I thought of some objects. So I handed her a rolling pin, and this is a true story. And I handed her the rolling pin and I said, "Here, Rose, this is to roll the dough." And I knew that she must have used one of these. And, you know, she started moving it around and she looked at me and she said, "I want to make a pie." That was the first sentence that I had heard from her since I had been working. So sometimes objects can kind of stimulate memories and open a door for communication. I had a gentleman admitted to, I used to work in mental health, and a lot of times I would see, you know, people unfortunately had an incident at home, probably because of poor communication. And this gentleman, you know, had an issue with waving a knife at someone. And, you know, I had to talk to him, and I could have taken the approach. I could have, you know, labeled him and been terrified, but I wasn't, because I just kind of looked beyond that. And I knew that he came from Puerto Rico and he spoke English. And, you know, I approached him and I just asked if I could sit down. And I said, "I hear you're from Puerto Rico." And he said, "Yes." And I just started singing from West Side Story. I was singing Puerto Rico, you know, that song. And he just looked at me and he was smiling. And before I knew it, the two of us were singing this song. So, you know, it was a connection. It was just something that I pulled out of the air to think of. And sometimes I don't always pull out the right thing, but I try different things. I just want to say one thing about religious hymns. It's not just the memories from long ago. It's also how often you do things too that are long-term memories. So, you know, for people who go to church and they've, you know, sing hymns and things like that, those can be really helpful. And this one particular resident, I didn't really have a connection with her, and I wasn't able to speak with her. But one day I just started singing the song that I remembered from high school, because I got out of Spanish class. We went to a Spanish mass and I remembered this song, and it was Alabare, Alabare. And it was basically sing Alleluia. And that was our little connection. So every time that I saw her, that was my way to connect. And, you know, nurses use that too, and anybody that was having any interaction with her. So music, we know it helps stimulate long-term memories. But, you know, think about it. What happens when you hear a song that you know? It can bring you right back to a certain time, right? It helps us remember details of our lives. So I had always wondered this, you know, why is it that a person with dementia can barely speak, but can sing or remember words to songs, but cannot remember family members' names? So a reason for that is that they may have damage to the areas of the brain that controls language, right? But because understanding lyrics to a song requires parts of the brain that control movement to understand rhythm, and the parts of the brain that manage emotions to understand melody in addition to language. So music is able to move through the areas of the brain that are not damaged in order for the person to sing lyrics. So, which is pretty cool. And I've seen that. I believe that works. So, you know, music is a go-to. It's a great way to connect. So if you're always trying to be normal, you will never know how amazing you can be. And I love this quote. I love a lot of her quotes. I think this goes both ways. So, you know, for yourself, if you are willing to just kind of step out of that comfort zone a little bit and just be you and just try things. I think that you will see just how amazing it all can be. And I think for the person, you know, we have to just let the person, they are still the same person. They are who they are. They are just having to find different ways to do things. And if we just, you know, can just allow that to happen and see and remember how amazing that person really is. So one of the things that I like to do is we create a memory for people. I think that it's a really great way to connect. I use a lot of sensory things. I remember when I was working in my job in long-term care. So we would have these boxes. They were like sensory boxes with different items that can stimulate memories. And so I decided to do this day at the beach one day, and I went and got like sunglasses for everybody. So everybody was wearing these sunglasses and these hats. And I actually put on over my clothes. I had on one of those bathing suits, and I think I even had like one of those bathing caps, like with the flowers. So I really looked really ridiculous, and people were really laughing at me. But you know what? We were having a lot of fun. And all of these sensory things, we had some suntan lotion. We were sharing memories, and you know, people were just talking about Coney Island and going on the roller coaster and just all kinds of really great stuff. And it was a wonderful day. We had a day at the beach. So engaging, that's what we call success. You know, what are we all trying to accomplish? Like I said, we all have, you know, different reasons for being here today. We all have different, you know, circumstances, but what are we trying to accomplish? And it could be all different things. It could be, you know, like I said, it could be a nurse working somewhere and needs to communicate with an individual. It could be, you know, a therapist like myself. It could be just a family or friend and just want to have quality time, joyful moments. And I love what Nicole said earlier about, you know, the feet and the pedicure. You know, one thing I didn't mention earlier is that, you know, my father, for the last probably like 3-4 years, he did not speak. He lost that. And I know that he was able to understand things, but we communicated. We definitely communicated, and I knew every feeling, I knew every look on his face. And, you know, it was just for me as his daughter to just sit and to hold his hand and to have his, you know, content look on his face, or, you know, to watch a music video on TV. It was still spending time together. And that was joyful for both of us. So I mentioned earlier about photographs. I think photos are a great way to try to connect with people. You know, instead of asking people, you know, tell me a story, tell me about your photo. And, you know, depending on, what a person is able to express, or even just, making comments about it. You look so happy in this photo, or if it's a picture from vacation. Oh, I love the mountains. I used to go camping in the mountains. Or if it's a picture of a dog. Hey, I have a dog too. And, and I used to do this as well with my own father. And, I would show him things from my life and show him pictures and talk to him. So I love this quote. It's not the destination, it's the journey. I'm sure we've all heard this quote before. Who do we want to be? Do we want to be the person that's enjoying the journey? Or are we going to focus just on the destination? There's a lot of things that we could miss along the way. And if you are present, you will see those things. And they just make us better communicators when we are really present and when we're spending time with that individual who has dementia. And that's it. That's me.
Thank you so much, Melissa. You can all unmute yourself if you'd like to ask any questions or share a story. I loved, well, I'm going to look here for any questions, but please feel free to speak up. I loved what you said about joyful moments, Melissa. I had one client, I'll never forget it. She didn't remember who I was, which totally fine. But what she said was, I don't remember your name, but I know you make me happy. I was like, I was just over the moon, because that was the kindest thing for somebody to say.
It is. That is very kind. And
it really is. It's those being present and being in those moments. And there's lots of hard times, right? When you're caring for somebody with dementia, it can be, as a family member or a caregiver, it can be a little bit heartbreaking, but recognizing being in that moment, and also that moment's going to pass. And if we can move on to the next moment, whether it's by redirecting or finding a joyful moment after that, it's so important for the caregiver and the person who you are caring for.
Yes.
Hi, this is Sheila. I have a couple of questions, if you don't mind.
Sure.
I missed the very first slide, so I apologize. Is dementia like Alzheimer's just a progression of dementia, or did I hear you say that Alzheimer's is like a type of dementia? Like, in other words, I always assumed that Alzheimer's was like the last stage, but is that not correct?
So dementia, in fact, I can even, well, I don't want to mess this whole thing up here. When you go back, I don't want to touch anything. When you go back, you'll see, but basically to answer your question, Alzheimer's disease is a cause of dementia. So, dementia in itself is, it's a group of symptoms, so to speak. And Alzheimer's disease causes a person to have dementia. So
Okay.
Does that make sense?
Yeah, thank you. Thank you for clarifying that.
So there are different kinds of dementia.
Yeah, and there are different types.
It's not that Alzheimer's is the last stage. There's different kinds.
Right.
Okay, that's what I thought you said. Yes, thank you for clarifying. That's what I thought I heard you say, but I wasn't sure. So that's good. I learned that one thing. The other thing too, speaking just from a personal experience, which is like pretty recent, I guess there's all like dementia progresses, I'm sure, differently in everyone. I always envision it as more of like a slow progression, but like my mom's been seen to like get like much worse over the last 2 weeks, like loss of speech, not fully, but really not able to communicate like a lot of the things that we were reviewing in the presentation. But one of the things she seems to be doing a lot is like throwing food. And that's like news to me. Like I've never seen that before. Like in the beginning, I was like kind of laughing at it, but now she's in a facility and, she's hitting other residents with the food. So I guess it's kind of serious. So what do you see from that?
Well, maybe I can't really say exactly because I don't know the person. I don't really know, but obviously there's something going on. And it could be, you know, when things like that happen, when I'm working with families, we try to track that because sometimes you can see like what was going on before that happened. Is there a change? And yes, it could be a change in the person, but it could also be a change in the environment. And those things happen too. I had a client, actually it was a resident. We actually changed the configuration of the room in the assisted living. And this was a person who he was just totally quiet. And all of a sudden he was really upset and he was just yelling and crying and just pacing because we took his bookcase away where he liked to sit. So, you know, it could be a lot of different things. That's something that I think, you know, perhaps if you speak to the people there, maybe there is a change. You know, sometimes it could be a new medication. Doesn't sound like that's what it is. But again, like I said, you kind of have to be a detective sometimes and look at what's going on.
It could be, yeah, a change
could
in
be.
medication. Yeah, that's true. But
Be
does
a
it
number of
signify
things.
pain? Like somebody in pain? Could it be that, or you're not sure?
That's another whole complex thing too, you know,
Yeah.
to assess pain. You know, I mean, I would be happy to speak with you more about this if you like. You can always reach out to me, you know. You can,
Okay, thank you.
you can definitely call me because we can talk about it more.
Thank you so much.
You're welcome.
Thank you, Sheila. Yeah, there's a lot of that, right? In the world when somebody has a diagnosis with dementia and then they are some reason they are agitated. I always say as a patient advocate, the first thing I always look at is pain, especially when people aren't able to vocalize themselves. I'm not saying that's the answer, but that's certainly,
Right.
as Melissa said, in the detective work, some place I look at first with their clinicians. The other is potentially a UTI. And again, like Sheila, you had mentioned medications, all of those things, because we don't know, and it's not a one, you know, one thing fits all. So you really have to kind of tick off all the things it could be, but that's definitely in the top things that I look at first.
Yeah. And for every response, there's a reason why it's happening. You know, we just have to figure out what it is.
Yeah, so, and that's a really good question, Sheila, because it's a very big misunderstanding that people think that it's definitely going to be some sort of agitation is going to come when somebody has a diagnosis of dementia, and that's not accurate. But one can understand if you're not able to make yourself heard, like Melissa was talking about, how frustrating that can be.
Yeah.
So again, the detective work. So thank you for bringing that up. Are there any other questions? Well, I want to thank you all again for being here, for sharing your stories, and Melissa for sharing this information. Again, the slide is up to be able, it has all of Melissa's contact information. She's a wonderful resource and a wonderful therapist. So I will see you out there in the ether sometime soon, I hope. And again, this will be recorded and be sent to you as well. Do you have any final words, Melissa?
No, thank you. Thank you all. I hope that you found it informative, and, you know, please send me questions. You know, I'm happy to speak with anybody. And thank you, Nicole.
Absolutely.
This was great.
Thank you for being here. All right. Take care, everybody. Have a wonderful week.
Thank you.
Thank you.
Bye-bye.
Thank you.